I agree with you because I think we've got after many IVF cycles and we lost money and psychologically we are tired, very tired. You can understand the emotions of the parents when they were unsuccessful after IVF situations. And we've gone on inside very solutions, but besides that, my wife is 38 years old, and because of that, we have to get quick. We have to behave quickly to get pregnant, and that's.
I want to listen to you situation.
Dr. Chen wants to hear about your case regarding
starting to my case. We've been married for. I also talked to Mr. Linges. We were married in 2016 with my wife. At the age of 32, both of us were 32.
Okay. So 2016 marriage and married at 32.
Yeah.
2016年 married， 然后32岁结婚。Dr. Chen is asking, how many pregnancies had you had from start until now?
Never. Only 2 pregnancies, chemical pregnancies, due to IVF procedures.
他说从来没有怀过孕，而且有的话也是2个受害人，而且是 IVF 的。
IVF 的。I see。月经规律吗
？Is her period regular?
Regular, yes.
Always regular.
Period regular, but 2 times at 26 days. 26 days endures 26 days, but once, Mr. Linges, once or twice, it's upper to 30 days. I supposed for chemical pregnancies then, but of course we haven't had a beta HCG. Because of that, we couldn't understand that, but 2 or 3 times, I think.
他说有2到3次是不规律的，剩下都是比较规律的，而且是26天。
I see。那个做没做过点油造影、宫腔的造影、宫腔的点油造影，或者是宫腔的环境思维彩超？
Have you, Dr. Chen is asking, have you ever had a HSG done or a 4D ultrasound of the uterus? Any imaging done? Dr. Chen wants to look at the shape or the imaging of the uterus. Have you ever
uterus? Yes.
Yeah.
I've got one ultrasound. Yes, I've got one ultrasound. Yes. After IVF procedure. After IVF procedure, I've got one ultrasound. But after IVF procedure.
他说他有一个 ultrasound B 超，可是是 IVF 过后的。
那不管是可以，我是那个没用，我要的是没怀孕前的子宫造影，你知道
HSG。So
HSG.
Yes, HSG.
Yeah, so Dr. Chen says it's best if this HSG is done before any procedure or pregnancies, so we can know the natural state of the uterus. HSG is an X-ray of the uterus.
Yes. Hysterosalpingography, I think. Yes, we got in March. We made in hysterosalpingography in March. We made. There were no problems. The tubes are opened and there is no polyp. Once a polyp in 2019 there was one polyp, 4 millimeters polyp, but in 2021 hysterosalpingography there were no polyps. It was all clear. Okay. I can show you the.
Yeah, can you show it? Is it okay?
Yes, of course.
Thank you. 他去哪了 ？HSG。
In
对不对 ？HSG 拍过3次，有的三个造影。
哦，
对
I see.
Can you send all 3 to us, if possible?
Of course. When I found, yes, all 3 are here.
Okay, great.
Yes, that reports in Turkish. They said no problem in uterine fallopian tubes. There were no problem in fallopian tubes, and there were no problem in the outside of the endometrial cavity.
他说那个医生是说那个输卵管都没有阻塞。
跟输卵管没关系，我只要宫腔形态。
Dr. Chen is more concerned about the shape and size of the uterus.
Yes.
The morphology, if you will.
宫腔
Morphology,
必须是这个形态，否则的话就会引起不孕或者生化妊娠。
So, do you see this model that Dr. Chen is holding? So a uterus has to have this shape. It's like a pear. So if a uterus does not have a pear shape, it will have some problems during getting pregnancies or chemical pregnancies or miscarriage.
宫体必须占2/3，宫颈占1/3。
So the uterine body has to be 2/3 of the entire uterus, and then the cervix is 1/3. It has to be in this ratio. Otherwise, there will be problems. So the HSG will let us know about this. Once we take a look, we will know.
这个宫底必须是这个穹隆形的。
So Dr. Chen says the uterine body has to have a shape like that. It's like a balloon shape on the top, where it's wider on the top, but then funneled towards the cervix.
Okay.
This is a sign of a healthy uterus. If it doesn't have this, then it will have problems.
We had hysteroscopy before. After our last IVF attempt, we had also hysteroscopy before, and our doctor said no problem about the shape of the uterus.
他说他的医生说没有问题的，不是说要不。
You got videos,
跟任何医生说，我要亲自看。
Yeah, Dr. Chen says doesn't matter what your doctor said, he wants to see for himself.
We've got hysteroscopy. We've got a video of our hysteroscopy. Can I send it to Mr. Chen?
Sure. Hysteroscopy for IVF?
Oh, yes. Before IVF, we had hysteroscopy and we have got the video. We've got a video.
他说他有一个宫腔镜的视频呢。
video。
他想发给我们。他这个宫腔镜
非常好，我最好要这个 HSG 的视频，宫腔镜的视频也可以。
Dr. Chen says this video is good, but what's most important is the HSG imaging. He can really help you with that. And then, right, I want to ask, what is this hysteroscopy, the purpose of? What was it done for? Do you remember?
Yes, the purpose is about the injury, making an injury to enhance the pregnancy after IVF.
So it was done after IVF?
Yes, it was between the 4th and the 5th IVF procedure.
I see.
Between the 4th and 5th IVF transfers, we made hysteroscopy for endometrial injury.
第一，我不看任何大夫写的报告，我只看照片和 video。Picture video, I think, I believe picture video. I don't believe doctor, writer, reporter.
So what Dr. Chen says, he doesn't believe in any doctor's reports. He just wants the imaging and the videos. He will make the diagnosis for you.
Yes, we have got videos, hysteroscopy videos, and hysterosalpingography photographs. We have both, and I will send to Mr. Manida, Mr. Linges, and you will be our partner.
Yeah, that's the first thing that Dr. Chen wants to say. So
yes, I can send them together.
你绝不要再做试管婴儿了。我本身就是试管婴儿大夫。这种试管婴儿不是实验性，而且是错误的，甚至会对你的子宫内膜带来伤害。
So second thing, Dr. Chen says you should not go for IVF anymore, because IVF
yes, we are thinking
is completely wrong solution for your problem. It is a misconception, and Dr. Chen himself, he is an IVF specialist in China as well, and he knows that.
Yes.
If you keep going off IVF, right, you will only bring more damage for the endometrial and the uterus because it's not fitted for your situation.
Yes.
我在中国就是做试管婴儿
的专
家，
家，而且是最早的专家。
所
以我对试管婴儿的实验证、禁忌证特别熟悉。你们这种情况不做试管，对我来说非常好事。你做过试管，给我带来了困难。从现在开始，好好避孕，别再做试管，等着我给你治。
Okay, so Dr. Chen, a brief history on him is that he is one of the earliest doctors to introduce IVF in China back in 1980s. So he's considered a specialist in IVF, and he recommends you to don't go for IVF because it's not suited for your situation. What you should do now is to don't get pregnant, be on contraceptives, because if you do get pregnant, it will most likely chemical miscarriage again, chemical pregnancy again. So what you should do, Ryan, is to don't get pregnant, and then Dr. Chen will help you treat your problem. This is what he's saying. Yes. He gives you his assurance and guarantee. Don't go for IVF first, because if you go for IVF, right, you will only complicate the problem even more. Yeah.
Mr. Chen, I agree with your. I agree with you because I think we've got after many IVF cycles and we lost money and psychologically we are tired, very tired. You can understand the emotions of the parents when they were unsuccessful after IVF situations. And we've gone on inside very solutions, but besides that, my wife is 38 years old, and because of that, we have to get quick. We have to behave quickly to get pregnant, and that's makes us more different for us.
Understood. So 陈院长他是说，他非常同意你的这个建议，他肯定会按照你的这个说法去跟着做。然后他说他们已经花了巨大的钱浪费在 IVF 了，然后2次失败也导致了他们两方都巨大的这个精神上的创伤，他们都有一些打击。因为他们38岁了，年龄也是有点大了，他们特别着急要有孩子，然后他们想尽了各种不一样的方法都不成功，所以他们现在是精神上的压力都有，所以他们希望这个问题是尽快可以想办法的，他们俩越快越好。
他现在的月经量能持续几天？月经的量和年轻前比差多少？
Dr. Chen, he understands your sentiments and he will do his best to help you. He wants to know, first of all, does your wife's menses period, how long is the period lasting for, and is the menses volume is as high volume as when she was younger? Do you know?
No. Not amenorrhea or dysmenorrhea. 26 days the menstrual cycle lasts for.
No, the 26 days is the full cycle. We just want where she gets the first day and then when her menses clears. Should be roughly 5 to 6 days. 4 days?
4 and a half. 4 and a half.
Before
no,
IVF.
Not longer.
Before IVF?
Before IVF, it was shorter. With IVF, in the IVF time, it gets longer, of course. With IVF, it gets longer.
IVF
because she's.
I see.
What about the volume now?
Volume.
Menses volume. Is she bleeding a lot or not much anymore? And before
mild.
IVF,
mild? So much, not bleeding much. But in chemical pregnancy, she bled. Yes, she bled much last year. But now she's not.
You can give us a rough idea. Before the IVF and after the IVF, is there a change?
No, there is no change before and after IVF. Only in after IVF cycles, first bleeding, she bleeds more. Yes, I was right. But in the second bleeding, she doesn't bleed much more again.
他说 IVF 手术之前之后都没有那个经量没有改变太大，可是呢，第一次生化妊娠流的特别多，然后第二次反而没有流太多。
I understand. 我有一个建议。China will open Olympic Games.
Do you understand what Dr. Chen is
Yes,
saying?
at Olympic, China will
You-
open their.
Hereby the ticket
go
go
to
to Beijing, watch Olympic game with
Treatment.
Intuman
hospital
treatment your disease.
Very good, very good. So I will rephrase it. So Dr. Chen
Yes.
he's learning English, so I hope you can give him some chance.
Yes, I understand a little bit. I understand.
So basically, what he's saying is that the Winter Olympics is starting very soon in Beijing. So he advises you to come, bring your wife, go for the Olympic Games, and at the same time, come to Beijing hospital, Dr. Chen's hospital, and get treatment.
Yes, I am thinking
If
about that.
you 2 years no have your baby, I return your full money.
So Dr. Chen says if you don't get pregnant within these 2 years and have a healthy child, he will give you back all your treatment costs, all the money that you spent. He's confident. We are very confident that if you come for treatment,
Yes,
you can get pregnant.
it's our priority to learn what your treatments are. It's our priority for a doctor like me to help my wife get a child from me as a doctor. Because I'm always searching. I'm always on a research about what can happen to my wife. What's the problem? Her thyroiditis. I said Hashimoto. She's suffering from Hashimoto thyroiditis. I think that's Hashimoto thyroiditis is the main cause, or the endometrium is the main cause. I don't know what, or the ovary is the main cause. I don't know, but there are many factors about our treatments.
Stop any check. Stop take any medicine. Wait for me.
Successful pregnancy, he wants you to make a video with him sharing your experience so that
Of
this
course.
video can share to other patients like her. Let them
Of
get
course, why not?
That's what he wants.
Why
to
not?
do.
Why not?
So why not? 就为什么不
Why-
就当然了
Of course, this will be the victory of Mr. Chen. Mr. Chen, this will be the victory of Mr. Chen. How can we succeed? I want to ask something. My wife has been suffering from Hashimoto thyroiditis. I suppose about this. She has got anti-TPOs, anti-thyroid peroxidase antibodies are high. Let's say 2,000, I think. 2,000, between 1,000 and 2,000. Anti-thyroid peroxidase antibodies. Hashimoto syndrome. She's been suffering for 7 years. And real threat to pregnancy.
Okay, you want to ask about his Hashimoto's, right?
Yes, of course. About Hashimoto's and the antibodies, apparent antibodies, are there a threat for miscarriages or chemical pregnancy?
他有一个问题想问你，就是他的妻子有这个桥本甲状腺炎，就是他觉得是不是因为这个甲状腺炎导致他的这个流产？因为他已经有了7年，然后他的这个Dr. Chen says the Hashimoto's plays no role in your chemical pregnancy because it does not affect the reproductive system.
Only immune illness of my wife is that on Hashimoto, but we've got many tests about this what about we thought about the lymphocyte immunization therapy, but after watching your videos, we went
another direction.
Against it. Yes, the opposite direction.
他就是要去做淋巴活疗的，前几个月就要去做淋巴活疗的，可是就看到了我们的视频，他说他是不是又要上当了，所以他就来找我们了。Scam.
Yes.
LIT lymphocyte immunization therapy 就是 LIT is a scam. So, Dr. Chen believes LIT is a scam.
Yes, many people say like that. It's unrecommended in United States. I know about this. I read much, but you know, it's hope. We're looking for hope. One of my friends' wife went for LIT therapy, and she's now looking for the results.
She was
She also
successful?
suffered from.
Was she successful?
We're looking for results, not successful. Still, the new they finished. Let's say this month, third therapy of the LIT, and she's going on IVF, looking for the results. We don't know. I hope she will be successful.
这个情况，你把你的所有现有的资料都发给我，然后呢，离奥运会的机会到北京去看病，很快就会有自己的孩子了。不要着急，千万不要再乱追着想办法。
Dr. Chen says you shouldn't just blindly follow these types of therapy, especially LIT, because it's banned for a reason. And Dr. Chen says you can rest assured, you don't have to be so distressed anymore, because Dr. Chen will help you. Send all your reports, the HSG, the ultrasound if possible, and also the video, send it to him. Come to Beijing, use the Olympics, come to Beijing, and Dr. Chen will definitely help you, give you a healthy pregnancy. Okay, so Dr. Chen says his time is going up soon, so he wants you to send the things over as soon as possible. And then
Of course.
let's discuss this on WhatsApp. We need to get you to Beijing as soon as possible. We cannot wait any longer.
Of course, we can conversate with you, Mr. Linges, and my
Yes.
situation. I will talk about my
希望我
situation.
们一起出现在奥林匹克
Dr.
的管理场上。
Dr. Chen says if you come to Beijing, he will bring you to the Olympics himself.
The second
Okay.
one, the last one. I want to ask about
Sure, go
the
on.
anti-spermatozoid treatment. I think my wife will benefit from this. I'm 50% sure that my wife will benefit from this therapy, because all the unsuccessful IVF cycles are, I think, due to the immune response of my wife. I think.
Correct. That's right. That's exactly right.
Uh,
So what is your question? You want to?
My question is to explain about a little bit about the anti-spermatozoid. It's like LIT, I said. What's its difference from LIT? I want to ask this question.
这是个好问题。
And is it convenient? I want to ask, is it convenient for us?
Okay. I understand. So 他问的问题是什么？他看了我们的这些专利啊那些，然后他也跟 LIT 相比了，他不知道是不是这样对说，就是他觉得 LIT 跟这个我们的免疫治疗有一点相似呢。然后呢，我们的治疗的那个方便度是多好多高呢？就是治疗的那个疗程是直接打针啊，还是要做手术啊？他问，就是方便嘛？
有可能需要做手术，也许同时要做基因疫苗。你跟他解释。
我可以解释。So Dr. Chen says there might be need of a surgery.
因为我高度怀疑，你告诉他，我现在通过和你的谈话，我高度怀疑他的子宫形态是个幼子，我需要给他做子宫塑形，然后呢要做免疫治疗跟那个关系没有，我们只取一段基因，就是基因疫苗。
Okay, so what Dr. Chen says, right, based on his experience, he has over 35 years of experience. And just by talking to you, right, he highly suspects that your wife might have a uterine malformation case. So this is not easily observed. Many doctors can do multiple HSGs. They cannot catch what's wrong with the uterus. Dr. Chen believes she might have a naive uterus.
Naive uterus.
Naive uterus. You can write this down and you can go for search it. Naive uterus is basically there's a problem with the shape and size. It is not easy to catch, but he believes your wife has this problem. That's why this chemical pregnancy is happening. Secondly, she has this immune response problem. We need to solve these two problems. How our immunotherapy works is that the vaccine works is a gene vaccine. Contains a gene that can neutralize the antibodies in her body. So these antibodies are anti-embryonic antibodies. They are attacking the embryonic cells during the early stage of pregnancy. So the gene vaccine works is that before pregnant, we will give her an administration maybe once per week, depending on how she reacts. Then we will check the levels. Once the levels drop, you can get pregnant. And then once you pass a certain time after pregnancy, your pregnancy is stabilized. So these two things, immune response and then the uterus problem. That's why we need to do a possible surgery for the uterus.
Yes. Yes. Okay. Anti-embryonic antibodies. How much we will? How many times we will make this immune response anti-embryonic antibody therapy? How many times?
4 times before pregnancy, and then 4 times after pregnancy is confirmed. That's it.
Can we perform this inside Turkey after the first procedure?
他说基因疫苗可不可以带回去土耳其呢？ Yes, definitely you can.
Really?
And you can bring it back. You can bring it back to Turkey.
I can after the first procedure in China, we can go to Turkey because we thought I will once or 2 times to China. We'll come once or 2 times.
No, you come 1 time only. 他以为要来好几次呢，就只来一次。No, 待1个星期对吧？ You just come 1 time, and then you might stay.
One time, 1 week.
1 week. 1 time, 1 week. That's it.
1 week is enough for us, I think.
Yes.
More than enough.
Okay.
You can bring the
Okay.
treatment back to Turkey.
If you wanna water birth the second time, go to Beijing.
Okay, so Dr. Chen says if you want to water birth, because our hospital specializes in water birth for delivery, labor, then you come back a second time.
我是中国，
Why
我
not?
是
But in
我
Turkey,
是
one
世界上
American.
体重分娩第一人。
Because Dr. Chen is also a water birth specialist, also the first person to do water birth in China.
Only one hospital in Turkey make water birth. Oh, it's American. It's the American hospital in Turkey.
他说土耳其整个国家只有一个医院做水中分娩。
你看我的 YouTube 频道了吗？
Dr. Chen says you should go to his YouTube channel. All of the water birth videos.
Okay, Mr. Chen, I thank you from my heart, everything, and I hope this is a very good, very fruitful conversation for me and a hopeful conversation. I'm going to look after this is important. Uterus hypoplasia is very important for me. I'm going to check it out also.
Understood.
About this. This is all I think I want to say. I thank you very much, very much. You're so kind. You're so let's say warm about accepting me. I'm going to be in contact with you again via Mr. Linges.
他很感谢认识你，然后他希望可以见到你，有一天。Yes, let's keep in contact. Dr. Chen is we are very excited to see you.
Yes, I do. 我也是。
I am
Yes,
also.
I'm also. Yes, I'm also
Happy to meet you.
happy to meet you.
Thank you. Thank you very much.
Hopefully in person, in a few months.
Yes. We're going to meet again. We're going to talk again.
他说我们可能会再相遇。他说。All right, thank you. If that's all.
Thank you. That's all. That's
All
all.
right, thank you.
I'm
Have a
going
good day.
to send
Yes.
yes.
You can send it to me. Yes. All right.
Yes.
Thank you.
Thank you for everything.